There are certain behaviors and patterns that are associated with addiction. To find out more, we went to Clean Treatment Center in Los Angeles to learn about what these patterns are and how to spot them in others.
Pattern identification and reduction therapy is a way of addressing people's negative patterns of thought, emotion, and behavior, which begs the question, what are those negative patterns? So some common examples would be people-pleasing, intimidation, seduction, aggression, all the behaviors that we're all prone to, not just the addicted population or a psychiatric population. Seems to me that with people who have drug and alcohol issues or psychiatric issues, they go hand in hand, so that there's a real commingling of negative patterns as well as mental health and chemical dependency issues. People in the drug and alcohol world are essentially very immature. If we really boil it all down, their progress got stopped at a point in their lives, either when they began to use drugs or alcohol, or perhaps they had trauma, which is below the drug and alcohol taking. And so there's a greater intensity of patterns, there's more patterns, and the patterns have greater impact on their lives than the average person. There are an indefinite number of patterns. I would say that I encounter approximately 60 to 80 patterns over and over again. Patterns of self-pity, complaining, whining, aggression, intimidation, sexual activity or seduction would be closer to where I'm trying to get at. So those patterns show up frequently, and in this population, some of the patterns that I see with more frequency are around the self-pity and poor self-esteem. They show up with regularity. The pattern and the addiction are entwined as far as I'm concerned. Did somebody's immature pattern, their way of coping with the world, come first, and then they found some kind of relief through drugs and alcohol? We talk about self-esteem, which is such a root problem for people who have addiction. They often started out in life with bad self-esteem, and then to assuage that, to diminish it or alleviate it, they began to take drugs or drink. There are very specific techniques that I will use to help somebody get greater self-esteem, and the starting point is very simply to look in the mirror, to have a lot of self-honesty, a lot of honesty about who we are, and then from there make a decision to, again, diminish or eradicate the pattern. You can do that through writing, experiential techniques, empty chair technique, talk therapy, so forth. There are many ways to increase it, but that's where it starts from, is an honest appraisal. Self-esteem issues are prevalent. We find them everywhere in every strata of society. For about 3.5 years, I simultaneously worked in a maximum security prison and in a high-end Malibu treatment center. And I can tell you that during that time, I saw exactly the same issues.
Once an addiction patient is in treatment, how long does it take?
To diminish or eradicate a negative pattern takes minimally months to start the process and truly years to complete it, if it's ever really completed. But we can make tremendous inroads, tremendous strides in diminishing and eradicating. It really begins with the client's willingness. Are they willing to make changes? And people who have hit some kind of bottom, whether it's drugs and alcohol or just a life bottom, they're often willing to do things differently, which is what's called for. It takes a lot of energy, it takes courage, it takes strength, and it can bear tremendous results.